Welcome again to the antigen antibody reactions sessions. This is the third video of this lecture series, and in this session we are going to discuss about again very important and most widely used antigen antibody reaction, that is agglutination reaction. Now, what we understand by agglutination? Now, we know that if a soluble antigen antibody reaction happens, then it is known as precipitation. But instead, if it is an insoluble antigen, it is a particulate antigen which combines or mix with its antibody in presence of optimum temperature, pH, and electrolyte levels, then instead of precipitates, we get clumps, and these clumps are known as agglutinates. So again, the mechanism of action is same, or theory behind this is same. It is Lattice hypothesis. So optimal agglutination is seen when antigen and antibody, they are in zone of equivalence. Now there are various types of agglutination taste: slide agglutination, tube agglutination, heterophile agglutination taste, Coombs taste, and passive agglutination taste. Now, why we need agglutination taste when we have precipitation reaction? Now, there are lots of reasons to this. Agglutination is more sensitive compared to the precipitation reaction. The clumps which we are getting in agglutination reaction, they are better visualized and interpreted compared to the bands of locules which are seen in precipitation. Again, agglutination are compared to precipitation, they are more faster in getting the results. So that's why the agglutination taste are widely used in today's era of modern diagnosis. Now, the first type of agglutination taste is slide agglutination taste. Now, what we do here, we take a slide and we take a drop of antigen and a drop of antiserum, and we make a uniform suspension, and then we shake the slide or rock the slide for a few minutes, and the positive result will be seen like this in form of clumpings of particles and clearing of the drop, and we get a milky homogeneous suspension if it is a negative result. And this method is widely used for typing of bacterial isolates. It is also used in case of blood grouping. So yes, slide agglutination is widely used today. Tube agglutination taste. This is more done for quantitative estimation of antibodies, and the best example that I can give you is Vidal taste. Now here what we do, we take a serial dilution of antiserum and we mix it with equal amount of particulate antigen, and then we see for clumps, and then we measure the titer. Now, what is a titer, or what is antibody titer or agglutination titer? That is an important concept to understand. Now, antibody titer of a serum is the highest dilution that shows an observable reaction with the antigen, which here is agglutination. And antigen titer can also be measured in serums in similar fashion by testing a series of diluted serum against a known quantity of antibody. So this will give us an amount or a concentration of antibody which is present, or antigen which is present in the serum. So it is used for diagnosis of typhoid in form of Vidal taste, brucellosis, or typhus fever. The third type of reaction is, or agglutination reaction, is heterophile agglutination taste. Now, what we understand by heterophile agglutination taste and why we need it? Now, here purpose is to detect antibodies against microorganism. But if I want to detect antibody, I have to provide an antigen solution. But what if I cannot get that antigen easily? Like rickettsia, which are intracellular organism, Epstein-Barr virus, or mycoplasma, whose culture is difficult, or whose antigen is not that much easily available. So what we do, we take a cross-reacting antigen whose antigen structure is similar to the organism that I want to detect antibody against. So we take advantage of this cross-reacting antigen and we perform the test by providing this cross-reacting antigen. So if I see a clump or if I see a agglutination, that means two things: either antigen is present against that particular cross-reacting antigen or the original antigen. We take an example of Weil-Felix reaction, in which my purpose is to detect antibodies again in typhus fever, that is antibodies against rickettsia. But rickettsia culture is very difficult. So what we do, I take a cross-reacting antigen of Proteus OX2, 19 and K strains. So if the clumps are seen, that means there are two possibilities: either antibody to Proteus is there or antibodies to rickettsia is there. So this is the purpose of heterophile agglutination test. The other example are Paul-Wanel test, in which what I want to detect is antibodies against Epstein-Barr virus in case of infectious mononucleosis. But what I use the OX-RBC antigen. Same way, Streptococcus MG agglutination test, in which the purpose is to detect antibodies against mycoplasma in case of atypical pneumonia. But what I will use a cross-reacting antigen whose structure is very similar to mycoplasma, that is Streptococcus MG bacteria. So this is heterophile agglutination test. There are many more also. Then there is Coombs test. Now Coombs test is to detect Rh antibody in case of erythroblastosis fetalis. Now let me give you a brief of erythroblastosis fetalis. When we have a Rh negative mother and Rh positive father, and if baby or fetus is Rh positive, then during first pregnancy, what will happen during delivery or whenever there is maternal and fetal blood mixed with each other, the fetus RBC will get into the maternal circulation, and at first pregnancy is totally normal, but this fetal RBC who has entered into the mother's blood will create an antibody response in form of Rh antibody. So the mother will develop Rh antibodies, and when this mother is again pregnant, so Rh negative mother will become pregnant again with the Rh positive fetus. Now these Rh antibodies, which are IgG in nature, can cross the placenta and it will react with the Rh antigen present on fetal RBC and causes the problems in the fetus in form of erythroblastosis fetalis. So our purpose is to detect these Rh antibodies. Now there are two possibilities: either I can detect these antibodies in mother's serum or I can detect these antibodies attached on fetal RBC. Now problem with Rh antibodies are that they are incomplete antibodies. So they will bind to Rh positive red blood cells, but they will not show agglutination. And that's why we have to take help of Coombs serum. Now what is a Coombs serum? Coombs serum is antibody against antibody. That means it is a rabbit antibody against human gamma globulin. So there are two types of Coombs test: direct and indirect. Now when I will use direct antigen, direct Coombs test is basically used to detect antigen antibodies which are present on fetal RBC. So as you can see here, we have a fetal blood having fetal RBC on which there is Rh antigen is there, and on which maternal Rh antibodies are present. Now what we do, though there is a binding, these cells are not showing me clumping because these antibodies are incomplete antibodies. So I will add this Coombs serum, and as soon as I add this Coombs serum, it will bind to this human antibody because it is antibody against antibody, and it will start to show the clumping. So direct Coombs test or direct antiglobulin test will detect antibodies which are present on fetal RBC. Now indirect Coombs test will detect antibodies in maternal serum, but because these are free antibodies in maternal serum, I will use sheep Rh positive RBCs. So what will happen, these antibodies will coat these RBCs, and then I will add an anti-human immunoglobulin or Coombs serum, which will show the clumping of RBC. So this is indirect Coombs test, which is used to detect antibodies which are present in mother's serum. Then we have passive agglutination test. They are used to detect antibodies against soluble antigen using agglutination test. Now we know that if we want to detect antibodies against soluble antigen, we have precipitation test, but here I want to use agglutination test. So what I have to do, I have to convert this soluble antigen into a particulate antigen. Now how I can do that? I will use inert carrier particles which are large in size and make this antigen particulate one. So what are these carrier particles? I can use RBCs, I can use latex particles, and we can also use bentonite. The most commonly used one is the latex particle. So latex agglutination test is there, by which we can, it is used for different tests in today's era of diagnosis, like antistreptolysin O test or ASO test, CRP or C-reactive protein estimation, rheumatoid arthritis factor estimation. And what we do, we take this latex attached antigen, mix it with the antibody solution, and if it is positive, it will show these white clumps, and if it is negative, it will show this homogeneous milky suspension. Now with help of this latex particle, you can detect both antibody as well as antigen. If you want to detect antibodies, as in this first diagram, then you have to coat this latex bead with the antigens. If you want to detect antigen, then you have to coat this latex bead with the antibody molecule. So with help of this latex agglutination, both antigen as well as antibody estimation is possible. Then we have a co-agglutination test, in which we use a bacteria known as Staphylococcus aureus, in which a COVAN1 strain is commonly used. Now this Staphylococcus aureus bacteria, on its cell surface, they have a protein called protein A. Now this protein A will bind only to the Fc portion of antibody. So we take advantage of this property to diagnose certain antigens. So what we do, we take Staphylococcus aureus and attach it with the antibody molecules, and then we mix it with the antigenic solution. If the desired antigen is present, then it will show us the clumping of staphylococci, or particle agglutination will be seen. So this is known as co-agglutination. So the example that I can give you is that this co-agglutination test is used to detect the Salmonella antigen in first week of illness. So let us see some questions which has been asked from this topic in the past exam. So which immunoglobulin class is the most efficient to produce agglutination reaction? Now we know that for precipitation reaction it was IgG, but in case of agglutination it is usually IgM. Tube agglutination test is used for serological diagnosis of all of the above. We can detect antibody against most of the bacteria or viruses. All are precipitation reactions except, so VDRL test was a slide flocculation test, CAN was a tube flocculation test, Vidal test is an agglutination test, and Ascoli's test was again a ring precipitation test. So only the Vidal test is agglutination test here, which is not a precipitation reaction. Which of the following are examples of heterophile agglutination test? And actually, if you see, all three of them are examples of heterophile agglutination test. Well, Felix, it is used for diagnosis of rickettsia using Proteus strain. Paul Bunnell, it is to detect antibodies against Epstein-Barr virus using OX-RBC antigen, and Streptococcus mg agglutination test is to detect antibodies against Mycoplasma. Again, Paul Bunnell test is an example of heterophile agglutination test. Which of the following is an example of passive agglutination test? So passive agglutination is all of the above. We can use either latex particle, RBC, some bacteria to make the soluble antigen the particulate one. So we will continue this antigen antibody reactions series, and in next session we will talk further about complement fixation test and other reactions.